Good afternoon, everybody, and thank you for being here for my short poster presentation. My name is Yasser Roshan, and I'm an assistant professor in Point Park University here in the beautiful city of Pittsburgh. Unfortunately, due to some schedule conflicts, I couldn't attend the session in person, but you are welcome to send me any questions or comments regarding this research. The current paper is a comparative analysis of 9 common classification algorithms for the specific application of screening diabetic retinopathy cases. This paper is the first step in future research on the topic and potentially developing commercialized techniques. So the first question here is, what is diabetic retinopathy? In most cases of patients with diabetes and due to the high level of blood sugar, the diabetic retinopathy will happen as a damage to the retina of the patient's eye, which can eventually lead to blindness of diabetic patients. Therefore, not only diabetic retinopathy can be an important sign to diagnose and follow up the progression of diabetes, but by itself is a dangerous disease that should be diagnosed in earlier stages and should be fully treated to prevent further damages. Generally speaking, diabetic retinopathy is diagnosed by an experienced ophthalmologist using a detailed and high accuracy retinal image, also as known as fundus image. The ophthalmologist will carefully investigate the retinal image for the signs and severity of different symptoms such as microaneurysms, exotodes, and hemorrhages. As it's clear in this figure, finding the signs and also grading them to investigate the stage of diabetic retinopathy is a specialized task which is highly objective and erroneous, which makes it difficult to diagnose diabetic retinopathy in earlier stages and at the same time makes it challenging for machine learning algorithms. Automatic screening of diabetic retinopathy is not a new topic in literature. There are various articles trying to use different feature extraction, image processing, or classification techniques to perform the screening or grading of DR. As there are multiple approaches in the literature, each with a different dataset, the authors felt a need to perform a comparative study on the available approaches before moving on to propose new solutions. This not only will unify the conventional approaches and makes room for new research, but also facilitates development practices to commercialize machine learning into daily practice of ophthalmologists. To do the comparative study, the well-known Mesidor dataset was chosen. An integration of multiple feature extraction technique has already been performed on this dataset, and 20 attributes for each image has been extracted, which are available in UCI dataset. This dataset is selected to compare 9 different classification techniques. In the initial step, 30% of the data was randomly selected as the test data, and the rest was used to retrain all the classifiers. Moreover, 4 performance indices of accuracy, precision, recall, and F1 score has been calculated to cover the comparison. This table here demonstrates the comparison of different techniques. For each technique, a set of tunable parameters are chosen and are optimized to get the best result of the classifier. This table reports the optimum tunable parameters for each classifier along with the performance indices. The table is included in the manuscript in the conference proceeding for further investigation if needed. Based on the comparison results, the Gaussian process shows the best performance with having more than 87% accuracy and F1 score, as well as 88% of precision and recall. SVM classifier with the polynomial kernel of degree 3 and adaptive boosting approaches are relatively close seconds, which by further tuning are having acceptable results. In the graph, you can see the change in the Gaussian process classifier result by introducing variations in the tunable parameters. So overall, in this paper, a comparative analysis of 9 common classifiers is performed in the application of automatic screening of diabetic retinopathy. Each classifier was optimized and the effect of tunable parameters on the classifier performance are demonstrated. Overall, Gaussian process shows the most promising performance. At the end, I just want to note that the performance graphs of all other classifiers are available, and you are welcome to contact me by email with a request of further information or with any other questions you may have regarding this work or even future steps of the research. Thank you for your time and have a great rest.